Thank you for watching the video. The heart is extremely important for living your life to the fullest and staying healthy until the very end. When your heart becomes weak, you may get short of breath easily, feel chest pain even with slight movement, have heart palpitations, or your legs may feel heavy and you might not want to leave the house. It's no exaggeration to say that heart health is the most important thing for your overall well-being. So, this time, I want you to go to the hospital if you have any of these symptoms. And not only that, but actress Miyuki Kobe and actor Takeuchi also lost their lives due to this heart failure. I never imagined that symptoms in the neck or legs could be signs of heart problems. If I had known sooner, I could have gone to the hospital. Please listen until the end so you won't have any regrets like that. Here at YouTube Medical University, we provide easy to understand and reliable medical information from a doctor's perspective to help you become healthier starting tomorrow. I'd be happy if you could subscribe to the channel so you don't miss any new videos. Now, let's get started with the explanation. The first of the 6 signs that appear when your heart is in bad condition is easy fatigue. This is about a woman in her 50s who came to my clinic. Doctor, lately I get tired easily even when I'm working, and I can't do housework or even leave the house on my days off. There was a woman like this. She was concerned about menopause and her thyroid, but to get to the point, it was actually her heart that was the problem. Even people in their 50s who are still young are not exempt from this. Conditions like congenital hypertrophic cardiomyopathy or arrhythmia can cause heart problems at any age. In fact, after undergoing various tests, she was ultimately diagnosed with heart failure, meaning her heart had worsened, and I referred her to a specialist. The heart is a pump that sends blood throughout the entire body. That blood carries oxygen taken in from the lungs and nutrients absorbed from the intestines, delivering them throughout the entire body. Because of that, oxygen and nutrients are distributed throughout our entire body, allowing us to live like this. If the heart becomes weak, nutrients and oxygen won't be delivered throughout the body. For example, when you exercise a little, the amount of energy and oxygen you need increases and the heart has to match that. If the heart can't keep up, you get tired easily and have to take breaks more often. Of course, getting tired easily doesn't always mean there's something wrong with your heart. Other causes of fatigue include menopause or anemia, diseases where the thyroid hormone, which controls metabolism, decreases, depression, or malignant tumors. There are many possible causes. Lately, you might feel like you get tired more easily. If your fatigue keeps getting worse, please make sure to consult a hospital. This also applies to issues related to menopause or depression. Does anyone here ever wake up at night to use the bathroom? Actually, even getting up just once at night to go to the bathroom is considered nocturia. Of course, just waking up once usually doesn't make you sleepy during the day or cause any particular stress. People like that don't necessarily need immediate treatment. However, waking up at night to use the bathroom could be a sign that something is wrong with your heart. When we're awake during the day, our legs are positioned downward. So, because of gravity, excess fluid tends to collect in our legs. But what happens when we're lying down at night? The height of the heart, the head, and the legs are all level, right? In other words, the fluid that accumulated in your legs during the day, that fluid returns to the heart, which causes the amount of fluid in your blood vessels to increase, and as a result, your body produces more urine. So why is it that people with heart failure are more likely to experience this phenomenon? That's because when the heart is weak, it can't work as hard during daily activities, which causes blood flow to back up and makes it easier for fluid to accumulate in the legs. And for a weakened heart, lying down like this actually puts less strain on it, doesn't it? The blood doesn't have to move up or down as much. When you're lying down, the blood flows through vessels that are more level. That's the idea. When that happens, the burden on the heart is reduced and the heart's pump works more effectively, so more blood flows to the kidneys and more urine is produced. I think it's easier to understand if you consider the reason behind it. Actually, the condition where you urinate more at night is called nocturnal polyuria, and people with heart problems also experience frequent urination at night, which is called renal polyuria. People with heart problems also have difficulty producing urine, causing fluid to accumulate in their bodies. At night, that fluid returns to the heart, which increases the number of times you need to go to the bathroom, so please remember to think of the heart and kidneys together. Besides that, there are other reasons for waking up at night to use the bathroom. There are various causes. In men, the most well known is prostate enlargement, and for women, the most troublesome issue is, it's called overactive bladder, which is a condition where the bladder becomes overly sensitive. I've made a video about nighttime frequent urination in the past, so please check it out from the description if you're interested. I also introduce stretching methods to help improve nighttime frequent urination, so please give them a try. Here are 6 unexpected symptoms that can appear when your heart is not in good condition. The third one is this. It's when you feel short of breath or start coughing at night. When you hear about shortness of breath or coughing, you tend to think of lung diseases, right? Like when you have a cold. Some of you might think it could be asthma, and that's a sharp observation. However, actually, having shortness of breath and coughing at night, those symptoms could actually be a sign of heart problems. So why do you feel short of breath or start coughing at night? The reasoning is similar to what I mentioned earlier. When your heart isn't working well, blood circulation gets congested, and during the day, fluid tends to accumulate in your legs, which are lower down. Then, at night, when you lie down and your legs are level with your body, that fluid returns to your blood vessels. When that happens, from the heart's perspective, the amount of blood suddenly increases rapidly. If your heart function is weakened, the blood returning to the heart will start to back up more and more, causing congestion. And the organs that are most affected by this congestion are the ones located just before the heart, namely the lungs. Actually, in our bodies we receive oxygen from the lungs, and that oxygenated blood returns to the heart. So, because there's a congestion in the lungs right before the heart, the lungs end up having too much blood, which causes problems for them. As a result, the lungs experience a traffic jam, which makes the exchange of oxygen and carbon dioxide difficult, causing symptoms like waking up at night due to shortness of breath. Coughing also happens for the same reason. The congestion in the lungs causes irritation, which leads to coughing. Please remember that. Suddenly waking up at night feeling short of breath and coughing is medically called nocturnal paroxysmal dyspnea. The term is difficult, so you don't need to remember it, but please keep in mind that it could be a sign of heart problems. Of course, having trouble breathing at night isn't always caused by the heart. As I mentioned earlier, it could be asthma, or quite often it could be something called sleep apnea syndrome. This happens when the brain neglects breathing during sleep, or physically, when someone has a small jaw or a large tongue while sleeping at night. Because of those skeletal or fat-related factors, it's easier for your breathing to become obstructed. Because of that, your breathing can stop at night, making you feel suffocated and suddenly wake up. Those kinds of symptoms can appear. In any case, waking up at night because you feel suffocated is a sign that you should go to the hospital, so please consider seeing a doctor. First, I mentioned getting tired easily. When the heart, which is the pump that sends blood throughout the body, stops working properly, the whole body experiences poor circulation and you become easily fatigued. And second, I explained about the increase in the number of times you need to use the bathroom at night. This happens because the fluid that accumulates in your legs during the day returns to the heart at night, causing the kidneys to produce more urine. And third, I introduced paroxysmal nocturnal dyspnea, which is when you experience shortness of breath or coughing at night. This also happens for the same reason as nighttime urination. At night, blood flow increases and the heart becomes congested, causing a backup in front of the heart. Let's remember that shortness of breath and coughing occur because fluid builds up in the lungs. If you found this helpful so far, please subscribe to the channel so you don't miss any new videos. That would really encourage me. Now, let's move on to the second half. Here is the fourth of 6 unexpected signs that appear when your heart is not healthy. Swelling of the veins in your neck. If you're wondering why the veins in your neck swell when your heart is not healthy, and for those of you who have watched the video up to this point, some of you might have guessed that this is the reason why the veins in your neck swell. As I mentioned earlier, the heart receives blood flow from the entire body and pumps it out to the whole body. So when the heart's function deteriorates, there is a traffic jam just before the heart, and because the head is above the heart, due to gravity, when blood returns from the head and there is a traffic jam, the veins in the neck become more prominent and easier to see. So, for those of you watching this video, after this, or even right now, please take a look at the veins in your own neck using a mirror or something similar. Please take a look at this image. There is a vein called the external jugular vein in the neck. When this vein is swollen, it could be a sign that something is wrong with your heart. It's common for anyone to have the veins in their neck become swollen when blood flows back from the head to the heart more easily. So medically speaking, it's not considered abnormal if the veins in your neck are swollen while you're lying down. However, if your external jugular vein is swollen when you're sitting upright at a 90-degree angle or standing like this could possibly be a sign that something is wrong with your heart. However, just because your neck veins are swollen doesn't necessarily mean there's something abnormal. A professional doctor will examine you and determine if there is anything abnormal, so if you are worried, it might be a good idea to visit a hospital and consult with them. For some people, it could be a sign of a lung problem rather than a heart problem. The reason is that people with chronic lung problems can develop something called pulmonary hypertension, where the lungs are under strain and blood flow in the lungs gets worse, which can cause blood congestion. People who have damaged their lungs by smoking too much, or those whose lungs are affected by conditions like interstitial pneumonia, are constantly affected by poor lung function. Sometimes, the blood vessels in the neck can become distended as well. I've posted videos about interstitial pneumonia in the past, so please check the description if you're interested. Here is the fifth of 6 unexpected signs that can appear when your heart is not healthy. It's palpitations. Everyone, have you ever felt your heart pounding? There are actually many patients who come to the clinic complaining of palpitations like this. However, what I want you all to learn here is that what you think of as palpitations can actually be caused by various things. Some people say that palpitations are simply when the heart is beating fast. And then there are people who don't necessarily have a fast pulse, but each heartbeat feels very strong. And there are also people who don't have a particularly fast heartbeat, but feel like their pulse skips sometimes, which makes them uncomfortable, and they call that palpitations. If you ever feel palpitations, I recommend that you check your own pulse. One place where it's easy to feel your pulse is the radial artery. It's this part on the thumb side of your wrist. Try pressing this part on the thumb side with your index, middle and ring fingers like this. How is it? Were you able to feel your own pulse? This is called self-pulse checking. Please try to get used to feeling your own pulse regularly. And when you feel palpitations, try checking your own pulse. If you can tell whether your pulse is fast, or if it just feels strong but isn't actually fast, or if your pulse is skipping beats, you'll be able to give accurate information when you visit the hospital, which will help you get a quicker and more accurate diagnosis. I actually teach this to my patients as well, so please give it a try. When your heart is not functioning well, palpitations are often characterized by a rapid pulse or skipped beats. When the heart is not healthy, it can't contract properly as a pump, so it tries to compensate by beating faster. And if you experience skipped beats, it could be a sign of arrhythmia. The heart contracts like this through electrical impulses, but if there's an abnormality in the electrical flow, the heart can't contract in a steady rhythm, and you may experience skipped beats, like ton 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 ton, with irregular pulses. If you leave this arrhythmia untreated, it can cause you to faint and collapse, or it can force your heart to work too hard, leading to a decline in heart function. So, it's dangerous to ignore it. If you continue to feel palpitations, please check your own pulse, and if you notice anything abnormal, consider seeing a doctor. Also, the cause of palpitations isn't always the heart. Many patients who come to my clinic say, "Doctor, I went to the hospital because I was having palpitations, but they told me my heart was fine and sent me home. However, I'm still experiencing palpitations. What should I do?" I often get these kinds of questions. Other than that, causes of palpitations can include anemia. Sometimes, the thyroid gland, which controls the body's metabolism, can become overactive and cause palpitations, such as in Graves' disease. Palpitations can also be caused by psychological factors like panic disorder. If your heart has been checked and found to be fine, these are other possible causes. So even if you've been told your heart is okay, if your symptoms persist, please visit the hospital again and let them know about your concerns. I've attached a video about panic disorder in the description, so please check it out if you're interested. The last of the 6 unexpected signs that your heart may be in trouble is swelling in your legs. If you've listened this far, you already know about leg swelling, right? The reason I introduced it here is because I really want you all to try checking for it yourselves. It's actually hard to judge leg swelling just by appearance. There's a method for checking swelling by pressing on the tibial tuberosity, which is the bony part of your shin. Please look at this photo. Do you see the part of your shin where you can feel the bone right away? Try pressing that spot firmly for 10 seconds. Even if your leg doesn't look swollen, after pressing for 10 seconds, some people may notice a dent appears. This is a sign to watch for. This is called lower leg edema. When the heart is not functioning well, its pumping action weakens, and the area most affected by gravity, fluid seeps out from the blood vessels into the lower part of the body, causing the legs to swell. And interestingly, by pressing for 10 seconds and observing how quickly the indentation returns, you can determine whether the cause is likely the heart or something else. If you press on the shin for 10 seconds and it takes more than 40 seconds for the swelling to return, this is most likely swelling caused by the heart or kidneys. If the swelling returns in less than 40 seconds, you should consider other causes for the edema. For example, if the edema is caused by a thyroid problem, it will not leave a mark and will return immediately. And swelling that returns in less than 40 seconds can be due to malnutrition or liver problems, and having cancer in the body. Because of such effects, there is a possibility that swelling is caused by a lack of protein in the body, especially a substance called albumin. Please try this on your own legs after this and count how quickly the swelling returns. Just by trying this one thing, you might be able to detect abnormalities in your body, your family's, or your loved ones' bodies at an early stage. Now let's review what we've covered so far. Here are 6 unexpected symptoms that can appear when your heart is not healthy. The 4th point was about the veins in your neck, called the external jugular veins, appearing swollen when you are sitting or standing. When your heart is experiencing congestion, the veins in your neck can become more visible and may serve as a sign to detect abnormalities. And then the 5th point was about palpitations. Check your own pulse to see if it's fast, strong, or skipping beats. Monitor your symptoms yourself, and if you notice anything unusual, please visit a hospital and consult with a doctor. And finally, the 6th point was about lower leg edema, or swelling in the feet. You should press on the shin bone of your leg for 10 seconds and check how quickly the indentation returns. Please give it a try yourself. How was it? This time, we talked about the symptoms that appear when your heart is not functioning well, and introduced 6 unexpected signs. The content might have been a bit difficult, so please feel free to listen to it as many times as you need or take notes to help you remember. And if you have any of the symptoms I talked about today and are worried, please consult your local cardiology department or your regular in order to live vibrantly, true to yourself, and healthily into the later years of your life. YouTube Medical University provides information that is hard to fully explain during outpatient visits and that you won't learn at the hospital. We explain preventive medicine and important knowledge about the body from a doctor's perspective. It would really encourage us going forward. If you enjoyed this, please give us a thumbs up or subscribe. Share your thoughts in the comments or tell us if a doctor has said something similar. I have these kinds of symptoms. Please share your experiences with us. Well then, see you in the next video. The Way to Live Without Aging from Your 70s, as taught to me by my patients in general medicine. It became a bestseller in 4 categories on Amazon and ranked #1 in the gift ranking. These are things I learned from my patients while working as a doctor. I compiled important ways of living and health methods into one book. It's a book that will make you think, I want to live a healthy life like this too. It's on sale now and getting great reviews, so please check it out.